earlier that the Integrated Health Service Plan is going to be our means of achieving the successes outlined in the blueprint. And you can see that over the next 12 years, we will have 4 Integrated Health Service Plans that will be developed based on progress that's achieved in the previous one. Will also be based on what is needed to align with future service accountability agreements. It needs to align with the decision-making, the prioritization based on the blueprint. And it will also allow for the incenting of health service providers and partners for integration and innovation as we move forward. We certainly need to work together. We know that the province is always going to have its priorities, and we want to make sure that we are aligning where we are going with that, while at the same time addressing those needs within our community. Our means of getting there is going to be through our health service providers and healthcare professionals. We ask that you continue to play the significant role that you have been in this. We want you to seek out opportunities to integrate as they align to the blueprint and the IHSP. We know that there will be some transforming of governance and leadership to facilitate and oversee change. We know that in order for us as a LHIN or as a system to achieve success, we all have to be prepared to recognize the successes of our partners across the LHIN. While it's important to recognize your individual organization successes, we also need to be looking at a system success, and we can only do that if we're all prepared to look outward. We're asking that you demonstrate how you fit into the future visions, both philosophically and operationally. This is our Integrated Health Service Plan for 2010 to 2013. You can see the system level goals: a healthier Southwest LHIN community, equitable access to services, quality of care and services, integration of healthcare delivery, and sustainability of the Southwest local health system. We have the blueprint identifying the 2 service delivery approaches. You can see our 4 Integrated Health Service Design strategic directions and the enablers, which I've already talked to. So what is your role going forward? We ask that you understand your accountability for your organization and the health system as required under LHIN. If you aren't familiar with the LHIN, we certainly would encourage you to access that information. It applies to all of us, and we need to be aware of it. Ensure that your board takes responsibility for understanding the blueprint and the IHSP, and that your organization's strategic directions align with these and with the overall strategy for the Southwest. Orientation for new board members becomes increasingly important, and we are finding that as a LHIN board. I'm sure you find that with your own organization's board. As we provide the orientation for these board members, we need to ensure that there is an emphasis on LHIN, the blueprint, and the IHSP, so that they understand how your organization aligns, the need for your organization to align, and how we can all work as partners to ensure the success of the system. And we ask that you approach your role from a population health perspective, understand the population you serve, and who else is supporting their needs. So that means looking outside your organization and what else is available close by within your community. Also identify other health system and other providers with whom you should work to establish partnerships that would result in outcomes related to improved population health, better patient or client flow, and more effective use of resources. You have a responsibility to monitor the success and outcomes being achieved, and we ask that you regularly discuss with your CEO or executive director how they are working to achieve the Southwest system level goals, and we ask that you monitor that progress. We also recognize that this is an increase in a bit of change of responsibility for you, but we appreciate your efforts to work towards the guidelines or the direction outlined in this deal. So, how can you find out more? Well, a communications toolkit was sent to all provider board chairs and CEOs at the end of March. And I actually brought mine with me today in case you haven't seen it, but it looks like this. And with it comes a little demo, a CD, which you can use, and it's to help you as you're providing information to your board, whether they are new board members or board members who have been there for a while, to understand the blueprint and the integrated health service plan. So every organization should have one of these. If you don't, I'm sure if you contact our office, we could see that we have, I'm sure there are one or two left over, right, Shirley? Yep. Also, if you could visit our website. There is a wealth of information available there, and I find that every time I go on it, there are changes. It's just getting a little more user-friendly, more adaptable, so feel free to access the information. In fact, we encourage you to do that. You will also soon receive a link to an animated voice presentation aimed directly at board members, and I think that is the flash presentation that I was working on. So, and it talks to you in a little more detail about the blueprint and the expectations of your board. And of course, you can contact us if you need more information. And at the very end, there is the information if you need to or wish to contact us, and our website is posted there as well. So at this time, I'm just going to go back. Are there questions from you, or we can move into the questions and the discussion of the questions that have been prepared there for you?